The eye is like a camera. Light rays pass through the clear front window of the eye. This is called the cornea. They then pass through the pupil and then the lens and are focused onto the retina at the back of the eye. This is like a light-sensitive film. On the inside of the cornea is a thin layer of cells called the endothelium. This is responsible for continually pumping water out of the cornea to keep it transparent. Let's have a closer look at these cells. When we are young, these cells have a regular size and are all six-sided, hexagonal. Through age, there is a natural process of the loss of some of these cells, and the remaining cells become bigger and less regular in shape. This is usually not a problem for the cornea. However, there are two conditions which are more common causes for accelerating this process of loss of cells. Firstly, cataract surgery. During cataract surgery, we use a phacoemulsification probe and pass this into the front chamber of the eye. We use this to break up and remove fragments of lens. The turbulence in the fluid of the front of the eye involved in this process will inevitably lead to stress to the endothelium. And there is always accelerated loss of cells because of this. If the cataract is particularly hard, or if there are factors that make the surgery more difficult, there can be particularly high loss of cells. The second common reason for reduced cell numbers is a condition called Fuchs endothelial dystrophy. This is a genetic condition that affects at least 1 in 20 people to a greater or lesser extent. As well as increased loss of cells with age, we see small droplet-shaped deposits on the cornea. These replace the normal endothelium. If enough cells are lost, the normal pumping of fluid out of the cornea is not adequate, and more water therefore flows into the cornea, causing it to thicken and become hazy. This leads to scattering of the light rays as they pass through the cornea. The vision will become blurry, usually just in the morning and gradually through the rest of the day as the condition progresses. The other effect one could see is in the epithelium. The epithelium is the layer of cells on the front surface of the cornea, shown in blue here. This gets thicker because of the swelling and waterlogging of the cornea, and tiny fluid-filled blisters can form. These can sometimes cause discomfort. If cataract surgery has caused swelling in the cornea, this can sometimes resolve over a few weeks as the eye recovers. No treatment will be needed. Likewise, not all patients with Fuchs endothelial dystrophy will need any treatment, as the condition may never get bad enough to affect vision. However, for those patients who have ongoing problems with vision, the good news is that in most cases we can perform surgery to treat this. How do we perform graft surgery? We carefully prepare an exquisitely thin layer of endothelium from an eye that has been donated by someone who has passed away. We fold this and inject it through a tiny incision into the front chamber of the eye. Let's have a closer look. We unfold the graft. We then inject an air or gas bubble to attach the graft to the inner surface of the cornea, where the unhealthy cells originally were. We leave the gas in for about 10 minutes and then remove some of this at the end of surgery, and sometimes also an hour or so after surgery. The remaining gas bubble then gradually absorbs over a few days. It is at this point that if the graft has attached and is working, the cornea will become less swollen and the vision will gradually improve over a few weeks to months.